It streamlined our practice.
It just seems as though we are much more efficient. Our documentation, I can go back a few years before we started this process and look at my notes, and based on the time restraints that we have in our practice, my notes were not nearly as thorough as they are right now. So I feel much better about my coding abilities to be comparable to the amount of work that I put into the note.
I think that physicians are slower, probably because they chart better now than they used to chart. They would perhaps just do a couple quick little lines on a piece of paper, and now they do more in-depth charting, which is better. And it's better for us if we have to track anything down. We can look in their note, and their note is complete, and it makes perfect sense.
A typical day for me involves a half-a-day clinic, half-a-day surgery. In my half-a-day clinic, I normally see between 20 and 30 patients. In the past, I would end the day with a stack of charts and would have to dictate either later that day or the next day. And since we started the EHR, when I finish clinic, I'm done with my notes.
Especially being a PA taking calls, it's very efficient on the weekends and at nights accessing information. And overall, it's just been a huge time saver for me.
In our field of obstetrics, our malpractice rate in Illinois is very high. We have incentives to lower our rates based on documentation in our medical records, and we get percent back, so many percent back for having an EHR, for having a specific OB flow sheet. We brought down our percent of our malpractice rate 9% when we went to an EHR.
And I would point out that it's very cost effective for physicians. And from a business sense, I don't like to talk much about business, but from a business sense, if a physician is only doing revenue-generating things, those non-revenue generating things can be done by someone else.
Well, the EHR has to be easy for the physician to use. Also, I believe that the workflow in the medical practice is going to have to change, and rather than have doctors being clerks and secretaries, I want doctors to be doctors.
By using the system, patient care is enhanced because of the speed that I can do the studies, or I can read the studies, and I can also manipulate images, and I can send the key images to the referring physicians so they can take better care of the patients.
I think the key for patients responding to this system is the efficiency that we get them in and out.
Clearly, we are more efficient using the Entergy EHR system than we were before. Our business in the last 2.5 years has probably grown anywhere from 30 to 40% over the last 2.5 years. My AR is less than it ever has been, and my AR is as low as it ever has been in the history of our company.
The most significant change that we experienced that had a financial impact following implementation, over the course of the next year we recognized a 10% increase in total revenue without any significant increases in the practice itself.
Our claims are definitely more accurate and complete before, particularly because of the ability to utilize the claim scrubbing product that Sage offers. That's allowed us to ensure that the claims go out in a much cleaner fashion than they did previously.
Because we're able to bill all of our claims electronically and also receive now a significant portion of our claims through electronic remittance, it certainly has enabled them to work the claims more thoroughly.
I think that Sage has helped us better manage the revenue cycle by providing the analytical tools that we need to see what's going on a real-time basis.
In fact, I think last month we reached 27 days in a true multi-specialty group practice is pretty impressive as far as I'm concerned.